So I'm Noel Lally. I'm the Nursing Director in the Immunisation section at SA Health, and I'm here today to talk to you about the South Australian influenza programmes in 2020. So the layout for the presentation, we'll briefly look back at 2019. Some of it has already been covered by Anne and Lisa. And then, of course, we'll focus in on the 2020 programme. The topics we'll focus on are planning that's occurred to date, what the funded vaccines and the eligibility criteria are, the schedule, so the South Australian schedule, some information around ordering, some information around the timing of influenza vaccination. We'll also talk about the importance of reporting and recording information, especially on the Immunisation Register. We'll talk a little bit about the Vaccine Administration Code and changes to the code ahead of the 2020 season, briefly highlight the available influenza resources, and just round it out with some key messages for 2020. So, reflections. This graph overlays influenza notification data and influenza vaccine distribution data as a means of understanding the context and analysing the programme rollout in 2019. The green line and green text on the left represents the number of vaccines distributed per week, and the blue line and blue text on the right represent the number of disease notifications per week. I just want to draw your attention to the red arrow here. So the first batch of vaccines available in the South Australian warehouse for distribution was Fluad only, so that's for the over 65-year-olds. And this wasn't available in the warehouse for distribution until week 13, and you can see that was well after influenza notifications had started to climb. It's important to understand that because obviously there was a lot of discussion publicly last year around the rollout of the programme, and it created, of course, a real sense of panic and urgency, both amongst the public and amongst providers as well. And there was a lot of talk about shortage of vaccine. The issue was that the vaccine just wasn't here. There was never a shortage of vaccine, and it's very important to understand that nuance going forward. Anne has already touched on this. The graph shows the 2019 season. This one shows it compared to all years since 2015. Obviously, 2019 was much earlier in terms of its onset, and it was a significant part of why there was extraordinary demand in the first few weeks of the programme. This graph compares the 2018 and 2019 seasons and shows vaccine distributed as a percentage of the estimated eligible cohorts in South Australia. So for the 6-month to 65-year-old cohort, if we split it up like that, so less than 65-year-olds, and those are the solid red and blue lines on here. So red is 18, blue is 19. The data shows us that in 2019, nearly 40% more vaccine was distributed for this age group than we estimate is actually required. So 100% is the population, so we distributed 140% of that. Obviously, that's a jump up from 2018, and 2018 was also significantly above the 100% mark. So that's the under 65-year-olds. The over 65-year-olds, you can see here in 2018 we distributed this much, around about, I haven't got that number there, but it's somewhere around 90%. And in 2019, we distributed 103%. So across all cohorts in the NIP, vaccine ordering and distribution exceeded the estimated eligible population forecasts. And it did result in significant increase in wastage in 2019. One of the things that's a little bit of a worry for us is that data that we've collected to date in terms of what providers are forecasting they will need for 2020 is putting their forecasts up here at 172% of the estimated eligible population. So we're worried, and I know we're all worried in terms of being prepared for flu season, but we're also worried about, the vaccine and making use of what is a finite resource. Those are forecasts. This may not be what occurs, but I just wanted to highlight this for everybody because I know nobody wants to get caught short with not having flu vaccine this year. We at the state level certainly don't want to get caught without it either, and the Commonwealth don't want to get caught without it. So I think everybody's on the same page here, but I just want to exercise a note of restraint around ordering and concern around what we may distribute this year. And again, this is just to point out how things have eventuated in 2019. So, as we all know, influenza vaccines expire annually. Influenza vaccine wastage due to that passing its expiration date increased by 40% in 2009 compared to 2018. So overall there was a 16% increase in wastage. So this was kind of balanced out by the fact that vaccines wasted due to cold chain breach actually went down in comparison to 2018. But this is the important one here that we're watching, and again, it's just so we all know where we stand in terms of vaccine ordering and distribution. 2019 influenza media and the facts, two things that shouldn't be mutually exclusive, but sometimes are. The role of the media in driving vaccine uptake and demand in 2019 must be considered. There was significant coverage around the influenza programme, primarily highlighting issues with perceived vaccine shortages and issues certainly around distribution of vaccine. You know, whilst media coverage is useful in promoting healthful behaviours, and it likely did contribute to an increased demand for the vaccine, the hyperbole and the lexicon, the words that were being used, for example, horror season and mutant flu crisis, I think they created a sense of panic and fear in some people rather than a sense of proactive, healthful behaviour or social responsibility. So, how does the picture of the flu season in the media compare with the actual evidence for the severity of the flu season? Whilst not dismissing the 121 deaths from flu we had in South Australia in 2019, including the death of the 15-year-old girl that Anne described earlier on, it's worth noting that according to the Australian Government Department of Health, their Australian influenza surveillance reports, the clinical severity of the 2019 flu season has been assessed as low, compared with their same assessment as of the 2018 season as moderate and the 2017 season as low to moderate. We had a lot of cases, but it wasn't unusually severe when you look at the last 3 years. I'd just like to pay particular homage to the Daily Telegraph's balanced and understated headline, so eloquently responded to in a letter to the Medical Journal of Australia from Dr. Vicky Shepherd and her colleagues in New South Wales Health. In particular, I draw attention to their closing line in that letter. We are working to reduce the impact of influenza on the community. Hopefully, we can achieve this without generating unfounded community concern. So, as immunisation providers and health professionals, it's up to all of us to mitigate the potential anxiety that this kind of coverage can cause by ensuring that the public receive balanced, evidence-based messages on flu vaccination. And we here in the immunisation section, SA Health, are here to support and provide all of you with that information as and when required. So just one more thing on the 19 season. We set up an advisory group, the Vaccine Preventable Disease Advisory Group of South Australia last year, and under the auspice of that group there was an influenza working group set up which undertook a review of the 2019 season and generated a set of recommendations broadly grouped under data, operational and communication. We'll touch on those when we look at 2020 and see how those recommendations have been put into place. So moving forward to the 2020 season. Planning to date, what have we done? So adopting the recommendations of the flu review from 2019, some of the measures we have implemented, this isn't all of them, but just for your information, include the following. So data-wise, with the endorsement of the advisory group and the support of general practice, which we sincerely appreciate because we know this is a significant undertaking, we developed a survey for providers focused on ensuring vaccine demand is definitively captured. I can't and won't go into details about the results right now because we don't have the time, but suffice to say that it was a useful exercise with important learnings. We will be reporting back to participants on those learnings, and we would expect that this will become an annual exercise that supports more efficient distribution of vaccine. Operationally, we've provided forecasts to the Commonwealth in October last year of how much vaccine we think we'll use this year, and it's taken into account the exceptional demand last year as well. We've been working closely and corresponding closely with residential aged care facilities and government agencies about the importance of planning ahead with regard to this year's flu season. We're obviously supporting these education sessions as well, which will be attended by hopefully up to 300 providers. And we're supporting several other education sessions across strategic aged care and primary health domains. From a communication perspective, with the support of the advisory group, we've developed a communications framework for the 2020 season to be shared amongst all of those representatives on the advisory group that will help everybody who has any interest in supporting or delivering influenza immunisation in 2020 with the key messaging around the season. So we're all singing from the same songbook, really. We will provide a weekly update to providers. Some of you may have already received your flu news. There's not a lot in there at the moment because really there's not a lot to say, really, because we haven't implemented the programme yet, but it will come out weekly. We'll provide media updates weekly, and we will brief the Chief Executive and Minister internally as well, so that we're on the front foot with regard to managing queries and discussion around flu in 2020. We, of course, will also have resources available on our website that you'll be able to access. So, with all that being done, we'll move on to the technical aspects of the 2020 programme. So, these are the funded vaccines in the 2020 programme. Some general points to highlight. These are all QIV, quadrivalent vaccines, so there are no more trivalent vaccines. So they all have 4 strains of influenza in them. Strictly speaking, Vaxigrip Tetra and Flu Quadri are the vaccines to be used for the NIP-funded universal 6 months to less than 5-year-old programme. That's the technical aspect of it. We, of course, understand that once the vaccines are in your fridge, it's very hard to keep them separated by funding source. But that is how the vaccines have been purchased, and if possible, that's how they should be used. And similarly with Fluarix Tetra, whilst it can be used in anyone from 6 months of age, it's only funded under the NIP for people 6 months and over with certain medical conditions. So that's your medically at-risk population. Again, we understand the complexity you'll face when it's all in your fridge. And, you just got to work with what you have in terms of the practicality of your situation. I would also note for you that there is a change to the minimum age for Flu Quadri. It used to be 3 years. It's been reduced down to 6 months of age now. Fluria Quad continues to be a minimum age of 5 years, which makes it a little bit easier from a provider perspective as well, because you can't use it in the child program. The child program is only up to 5 years of age, so that's a good thing. And with the Fluad Quad, this is the adjuvanted vaccine that's been specifically formulated and is the preferred vaccine for the over 65-year-olds. And note that this now is a QIV, so quadrivalent vaccine, whereas last year it was trivalent. So that should remove some of that discussion around, can I have the trivalent and then have the quadrivalent, or if I've had the quadrivalent, can I have the trivalent as well? I sense a lot of people had those discussions last year. In terms of the strains in the vaccines, all vaccines in 2020, as I said, are quadrivalent. Information from the US Centre for Disease Control shows that as of week 5 in the 2019-2020 season in the Northern Hemisphere, influenza A types have caused 65.8% of all influenza illness in that hemisphere, and the Brisbane subtype has caused 95.7% of those cases. With influenza B, they've had 34.2% of cases ascribed to influenza B, with the Victoria subtype, this one here, responsible for 99.5% of those influenza B cases. So we expect that the vaccine will be well matched to the likely circulating strains down here in 2020. So who is funded for a vaccine in 2020? Looking firstly at the National Influenza Programme, influenza vaccine is funded for those who are medically at risk from 6 months of age. It's important to note that when we say medically at risk, we mean those with medical conditions associated with an increased risk of influenza disease complications. In 2019, there's been a lot of feedback from providers and indeed the community with regard to confusion over who is eligible for a free dose. And it's apparent that this is particularly true for the medically at risk category. I draw your attention to clarify this to the ATAGI statement, which we received yesterday from the Chief Medical Officer of Australia, Brendan Murphy, and it will be published on their website, if not already, within the coming couple of days. The link will be embedded into this PowerPoint as well, and we will have it on our website, I think, or at least a link to it. I would also note that details around who is considered medically at risk will be included on our schedule as well. They were on there last year as well. So yeah, if you're not sure, refer to the schedule. Moving on to the next eligible group, all children 6 months to less than 5 years of age. This is now a Commonwealth funded programme. Previously it was state funded. Just on this particular group, it's worth noting that if a child is aged 6 months to less than 9 years of age, and this is their first year receiving the vaccine, they require 2 doses at least 4 weeks apart. If they are in this age group, 6 months to less than 9 years of age, and they've previously had at least 1 dose in a previous season, then they only need 1 dose going forward. The next eligible group is pregnant women at any stage in their pregnancy. Some points worth clarifying for this group include, and this is from the updated ATAGI statement we got yesterday, influenza vaccine is recommended in every pregnancy and at any stage of pregnancy. If a pregnant woman has received a 2019 vaccine in this pregnancy, a 2020 vaccine should still be offered. Influenza vaccine can safely be given at the same time as pertussis vaccine. And this is a new one. Women who receive an influenza vaccine before becoming pregnant are now recommended to be revaccinated during pregnancy to protect the unborn infant. Okay? All people aged 65 years and over are eligible for a funded dose of vaccine. Fluad Quad is the recommended vaccine for this group, and there is no requirement or recommendation to give it if they've previously received one of the other 2020 vaccines. Because I think what happened last year was sometimes the Fluad Quad wasn't available, so they were given the standard, if you want to call it that, quadrivalent vaccine, and then told to come back for their Fluad Quad. That's not necessary. They need just 1 vaccine. Fluad Quad is the recommended preferred one. They don't need 2. And the second dose is not funded if it is decided to be given. Last but not least, under the National Immunisation Programme, all Aboriginal and Torres Strait Islanders aged from 6 months are now eligible for a funded vaccine. This is a great initiative, particularly given the burden of disease in this particular population. Just looking briefly at the state programmes, South Australia is now in 2020 funding influenza vaccination for all people who are homeless, regardless of their eligibility criteria otherwise under the programmes. So the mere fact of being homeless entitles you to a funded influenza vaccine dose. The other state-funded immunisation programme is that for SA healthcare workers. That will be relevant to some of you here. It's for SA Health employees only, and details on who should receive a flu vaccine dose can be found in the Immunisation for Healthcare Workers in South Australia Policy Directive. This is our schedule. You probably can't see it very well. Obviously, we'll be sending this out as part of an information pack to all providers. It includes information on the eligible categories, specific medically at-risk categories, eligibility criteria for the homeless programme, and it also includes a table showing which vaccines can be used in which age group. It also, of course, does down the bottom contain that caveat around how the vaccines are funded and in which groups you should be using them. So, vaccine ordering. This is a picture of me at my desk trying to work out how much vaccine we're going to need for 2020, and I'm sure all of you feel this way. We understand the pressure providers are under in terms of dealing with demand from patients. for the vaccine, and we know you do not want to be in a position where you run out. We don't want you to run out either. That being said, it is up to all of us to ensure the programme is measured and coordinated in its implementation. And I just want to touch on one of the reviews from, one of the recommendations from the flu review, and that was to consider strategies to more accurately establish individual provider eligible population cohorts. So historically, as providers, we've based our expected need on last year's ordered amount plus a little extra for the coming season. As already shown, the previous season's ordered amounts are not a reliable indicator for future need. They don't necessarily consider wastage in the previous season, and consequently it leads to inflated estimates year on year. So what we would strongly encourage people to do and ask people to do is, as a solid evidence base for accurately defining your required number of doses, would encourage you to use your available patient information systems to define your eligible populations. And we're here to assist in terms of, rules of thumb around, how much should we need for people between this age and this age. We're more than happy to answer questions on that. 2020 vaccine ordering. So when can you order? We will enable ordering of vaccine from Tuesday, the 24th of March. This date has been selected, so all providers will receive at least one order of vaccine before the Easter long weekend. Easter happened in the middle of deliveries last year and it created problems for us, but also for you as providers. This is an important point, only vaccines that are physically available in South Australia in our warehouse will be visible on the order form. So not all vaccines are going to be available on this date. They come in, they don't all come in at once. So any vaccines we have, we will make available to order from that date, but be aware that not all vaccines are available from that date. We strongly encourage, like we suggest to providers, and I know this is a temptation, try to avoid the temptation to fill your clinic appointments before you know vaccine is available. Easier said than done, because I know there are practical considerations as well around planning your business. But the fact of the matter is that until you receive the confirmation from us that the vaccine delivery is on its way, it's not a confirmed order. It's just the reality of the situation. We want to avoid situations last year where some providers had to end up cancelling clinic bookings because the vaccine orders hadn't been confirmed. The bookings had been locked in ahead of that and the vaccine just wasn't available. So we are thinking about the impact that it does have on you in that regard as well. As I said, it's the reality of the situation. Not all vaccines are available immediately, and not all vaccines can be delivered to all 800 providers across the state on the first day. As vaccines become physically available, as we receive them into the warehouse and they're sitting there ready to order, they will appear on the VDC order form. Some suggestions: please check the VDC notice board daily. Important updates will be posted on the notice board as and when required. Please refer to your delivery schedule for fortnightly delivery dates and order cut-off times. If you don't know where to find your delivery schedule information, it's in your VDC account. Just log in, hover over the My Account section, and then select Delivery Schedule from the drop-down menu. If you miss your cut-off time, this is really important to understand, if you miss your cut-off time, your order will be delayed. No urgent deliveries will occur in the first fortnight. This has always been the practice, and it's just to allow us to get everybody their first order. Okay, some more crystal ball gazing. Timing of influenza vaccination in 2020. The key message here is to vaccinate from mid-April. This is consistent with the letter from the Commonwealth Government Chief Medical Officer, which accompanied the release of the ATAGI statement yesterday. It's important that we all give clear messaging that is consistent with the Commonwealth Government messaging. This is their funded programme. There is no easy answer to this. All we can do is align our messaging to how influenza disease has generally behaved in the past. As a result of this, the timing recommendation is focused on ensuring optimal protection against influenza, which occurs within the first 3 to 4 months following vaccination. And this aims to achieve the highest level of protection during peak influenza season, which is usually from June to September in most parts of Australia. With regards to prioritising who you vaccinate first, take note of the special needs of those over 65 years of age, pregnant women, children who obviously have a higher degree of morbidity, mortality, and are also acknowledged as super spreaders of influenza, the medically at risk, and one group that's not up there but we should mention is those who are travelling to a destination where influenza is circulating, and influenza circulates year-round in the tropics. Finally, on revaccination, we've already touched on the change to the recommendation for revaccination in pregnant women. Otherwise, revaccination later in the same season for individuals who have already received a vaccine is not generally recommended and is not funded. There are some specific exceptions, around immunocompromised, solid organ transplant recipients, etc., but generally it's not recommended. Just a clarifying point on egg allergy and influenza vaccine. There was an apparent degree of confusion on this last year, so to clarify, people with egg allergy, including a history of anaphylaxis, can be safely vaccinated with influenza vaccines. Where there is a known anaphylaxis egg allergy, these people should receive their vaccine in a medical facility with staff experienced in recognising and treating anaphylaxis. They should remain under supervision in the clinic for at least 30 minutes after vaccination, and they should receive the full age-appropriate vaccine dose. These recommendations can be found in the Immunisation Handbook online version, and again, we'll obviously have a link to that in this PowerPoint. Some of the practical aspects of flu programme management. Just encourage everybody to be sure that you've got enough fridges, and obviously that the fridges are big enough to store the amount of vaccine you're holding. I just remind everybody that the Strive for 5 recommendations were updated in 2019, and please make sure you're using the current edition of the Strive for 5 guidelines. 2 key recommendations and changes in there were that domestic refrigerators must not be used to store vaccine. And the other recommendation is that purpose-built vaccine refrigerators must be continuously monitored using a data logger. For those requiring a refresher or training on cold chain, New South Wales Health have an excellent online training module. If you do experience a breach in cold chain, isolate the vaccines, leave them in your fridge, just put a sign on the door saying do not use, and give us a call. We can only answer these calls in business hours only. After hours, it goes through to the duty doctor and they can't help you. So if it happens after 5:30, you wait until the following morning to give us a call. Still isolate the vaccines. Please make sure that you report all vaccine doses to the Australian Immunisation Register. It's important for patient safety in terms of avoiding programme errors or over-vaccination, but it's important as well that we have a comprehensive picture of who's getting vaccinated, and we just don't have that at the moment because the data is not consistent and it's patchy. Changes to the Vaccine Administration Code for 2020. The new version is in the process of being published. It will be available online soon. The key changes are that in South Australia, pharmacists as a class of recognised registered health practitioners will now be able to administer non-funded influenza vaccine to individuals from 10 years of age. The updated version of the code also introduces a little more definition around what is a specified immunisation programme, because there has been some confusion amongst providers about what vaccines they can use and for what reason. So that's been clarified in the new version of the code, and a letter clarifying these changes will be sent to all providers. Lastly, I'll draw your attention to the resources we have online. There's the SA Health Flu page referred to by Lisa. We have our own immunisation webpage. For those of you who are registered vaccine providers with us, you can also order through the POSCAT system your resources online. There is also the national resources, the TAGI statement. You should be able to find it online any day now. And of course, the Commonwealth resources as well. Key messages. There is enough influenza vaccine for our eligible population. There is more than enough. We'll begin the funded vaccine distribution from the 24th of March, but not all vaccines will be immediately available to order. Vaccinate from mid-April. It's important that we manage public expectation with the key evidence-based messaging, and that's why we'll be sending out those weekly updates, so you'll have the the evidence to hand that you can respond to queries or perhaps complaints with. Ensure communication from SA Health and the Vaccine Distribution Centre is being read by the right people. So one of the things we found last year was that, yes, the emails were getting through, but they weren't going to the right people once they got to that particular service or organisation. So make sure you know who's managing your flu programme and make sure they get the correspondence. Look, we're here to help. Just call us if there are any issues. And that's pretty much it. Thanks. Sorry, I went a bit over time. Any questions?
Just with revaccination, we've had a couple of patients that have already come in to get 2019 vaccination because they're travelling to a flu country now. I'm guessing that they're still eligible for their 2020 when they get back, or what sort of coverage do they get from the 2019 having had it now? So
yes, they would still be eligible for the 2020, but obviously you'd have to observe minimum intervals. The other thing that just to note that I'm not sure there will be any 2019 influenza vaccine still out there because it should all have expired by now. Yes. So there shouldn't be any 19. Good.
So thank you, Noel. Can I just support the work you've done since last year? There was a problem for all of us as providers to actually look after our patients. The influenza came earlier than we were expecting, and certainly in residential aged care we had outbreaks before we had vaccines. In response to that, I appreciate the invitation to be involved in some of these programs, and I know you get annoyed with me in those meetings as members of the Vaccine Preventable Committee and with the influenza, but appreciate the dialogue and the opportunity to engage. So just in transparency and in issues, the headline where it said at Flinders that there was a vaccine shortage for the workers, there was a vaccine shortage for people because they came in bigger numbers than we anticipated and there wasn't supply there. So technically that's accurate. I also think there's a concern about getting deliveries, and the oversupply or people over ordering is because of people's nervousness. And we've had this discussion formally and informally over the last year. And just to say that it still hasn't been solved completely, but I certainly appreciate as a provider and working with our colleagues that the department is looking at that, but there still is some concern about if we've got shortages or we need extra supply, can we actually rely on deliveries and coming? So without having the discussion sort of publicly about some of the solutions, it is still a problem, and it, I think, is what causes the over-ordering as we're all trying to work out how do we actually make sure we've got. And then just finally, the vaccines that will be offered in private that aren't National Immunisation Program, they're not NIP, but they are valid vaccines. They will be offered in the private sector from the 30th. They're in warehouses in the next week or so. We know they're going to be available in clinics by the pharmacy. And so there is, again, the tension between what the government is saying, this is a national program and you start from mid-April, and what we face with our patients actually getting vaccines. So it's important that providers actually realise that because it's a Commonwealth program doesn't mean that vaccines aren't valid. And Stephen, the Health Minister, said this morning on radio that maybe it's better to have it later. Most of us actually think the evidence from last year says the vaccine waning is not a real issue. WHO reviewed and issued a report in November showing that the vaccine is still effective even if given early. And we've got coronavirus and we don't want to be mixing that. So private vaccines and legitimate vaccinations will actually happen and it will challenge us. Thank you.
Thanks very much, Rod. Thank you for the positive feedback as well around the advisory group. I think we all as providers are much more united in terms of where we're heading this year and what the messaging should be. We are making the vaccine available from the 24th. As soon as we have it, you can order it. The message is to vaccinate from mid-April. We're not going to be checking on people between when you get the vaccine and when you're supposed to be vaccinating to see what you're doing with your vaccine. So take that whatever way you like. But we understand the pressure. We understand the pressure you will be under, But I think it's particularly important to understand on the issue of shortage, if you order vaccines, 100 vaccines, and you give 100 vaccines, you're not going to get any more vaccines until you're next due for an order, particularly in those 2 weeks. So yes, you may experience a shortage at your provider level, but there is no shortage, and there was no shortage in terms of our overall state. And that was the issue that they had at the clinic as well at Flinders last year. The demand was greater than what they normally encountered. Thanks, Rod, I appreciate it.
Quick question. Can you please clarify, a simple question, Noel, is this statewide and NIP vaccines will be available from the 24th?
All vaccines that we have available will be
So the
available
healthcare
to
worker
order
program, we can start ordering from the 24th?
if we have the vaccines.
Will
You just need to go on the 24th and check and see what vaccines are available to order on the 24th.
I just wanted to check, you mentioned about pharmacists being able to vaccinate from 10 years and over. Is that official in SA as yet?
It is being gazetted, so it will be made public any day now. So the process is occurring internally, but you're probably looking at least another 1 to 2 weeks before the Vaccine Administration Code is publicly gazetted and becomes part of the regulations that sit under the Controlled Substances Act. But it will be before flu season, our dates, so it'll be aligned to make sure that it happens in time and is aligned to when we're rolling out the programme.